So Bernie Sanders is at it again, huh? He's talking about how people are going to lose a bunch of health care and can't afford anything.
Getting a lot of questions lately about, what this government shutdown is about. So let me tell you, right now
Please, Bernie, please tell me.
in Vermont and all over this country, insurance companies are sending to their customers the estimates of what their new premiums will be. In Vermont, literally today,
Okay.
people are receiving information that there will be a doubling or in some cases a quadrupling, 4 times increase in their health insurance premiums. And this is on top of the fact that 15 million people.
Okay, so doubling, quadrupling, yeah, I've seen that. But that was only on healthcare.gov, which, by the way, the government put together. And he would probably, I don't know where he's getting the data from. Maybe Vermont. Vermont's a blue state, if I'm not mistaken. Let me double check, actually. Vermont voting base. Let's see here. Dem or Republican? Yeah, that's primarily a Democratic voting space. I'll tell you, anytime the government gets involved, it just gets really, really expensive. And like, there's no context. So if he's talking about like up someone's health insurance premium going from $20 to like $80, of course, that's quadrupling, or even like $100 to $400. Yeah, but guess what? Tax subsidies ran out, which should have never existed to begin with.
Are being currently thrown off of healthcare if Trump's proposals go through.
Okay, to be honest, you got 360 million Americans, only 50% of them are adults, 180. There's only 5% of the population that's on, it's like, I think it's like 5 to 8% that's on the government. So let's just take the medium. So if you take 150 million people, multiply that by 0.8%, I mean, like, he's saying the entire population is going to get thrown off healthcare.gov. That's not true, because there are people who can't afford it and they have to have it because they are sick, because that's what healthcare.gov is used for. It's such inflammatory. It's crazy.
So that is what this shutdown is about, is whether we allow working class, middle class people to be paying, in some cases, in Vermont, around the country, over $50,000 for a family of 4.
Okay, the other thing I'm going to say to this, he's probably taking one example, 50,000 divided by 12 months. I don't know a single person who is at $4,200 a month. The most expensive quote we have ever given someone, and that's because they literally bought the lowest possible deductible on the planet with the most amount of benefits possible with a massive family, was like $3,200 a month. And it was crazy. And we were like, this is really expensive. We don't recommend this. And they're like, yeah, but my Cobra is like 34 and I was going to pay that anyway, so I'll take it. I'm like, okay. So 42, yeah, that's a healthcare.gov and a government problem.
For health insurance. Who in God's name can afford to pay $50,000 a year for health?
Nobody, because nobody's paying that much.
Insurance. So what this shutdown is about is telling Trump and his Republican friends.
Oh, yes, because it's Trump and the Republicans that are causing 100% of the issues. Ay, ay, ay.
You know what? You can't give $1 trillion in tax breaks to the top 1%, to Musk, Bezos, and all your.
Of course, they're going to say triggering things. I'm not going to have a tax debate with anybody right now, but anytime we increase taxes, it always gets, like, business owners just pass it on to everybody else. So anyways, that's a whole other story.
Oligarchic friends, while at the same time, you're destroying the American healthcare system and making healthcare totally unaffordable for the American people.
This is also the same guy that said that we should be taxing millionaires out the wazoo. And then the moment he became a millionaire, started saying that we should tax billionaires out the wazoo. So, like, the guy and almost every politician just changes their stance every single time. Like, it no longer fits what they want to say. Yeah, I mean, like, join the movement. What a joke. Like, nobody's paying $4,200 a month. If there is somebody out there, I don't know of anywhere else other than Vermont. I've never even heard of a quote that high. Like, I've never, I'm doing this for 6-7 years, never heard a quote that high. And that's the, I mean, it's gonna be government driven, and yeah, that's bad. But he might be just taking one example. And if there's more than one example, okay, let's say there's 50, but like, that's crazy, even if it's more than 50 people. So don't believe everything you hear and see. Hey, thanks for watching the content. If you want to have better health insurance, whether pricing or coverage, you want something different or new, you want something where you feel like you have hands-on support from a live agent in the actual process of getting the policy and the post part of actually filing claims, please go to our website, click on the link below, or fill out our lead form. You'll catch a live agent. Our focus and intention is service, and that's all we focus on. And so if you want to work with someone who will hold your hand through the entire process of getting your policy to helping you file claims when that is necessary, you've got to work with us, because let's just face it, we're the best.